Hello, I'm Dr. Charlene DeHaven, Clinical Director for Innovative Skincare, and it's my pleasure to be here today with Dr. Michael Holloway, who's the founder and medical director of Synergy Med Spa MD. Tell us, Dr. Holloway, why it's important to prep the skin before a procedure.
Well, I think, when a patient or client comes to us, again, we've got to do a proper assessment on what is it we're trying to treat. And many med spas like ours, we have different, products, treatments, things, lasers, IPL, fractional, whatever it is we're trying to accomplish. And so having the skin in its most optimal state of health prior to a more aggressive treatment, I think helps that treatment achieve optimal results. I've been doing this for about 20 years, and I realized maybe 10 or 15 years ago that pre-treating the skin and getting it to a condition where it can receive either the IPL in the photofacial or a fractional, whatever it is we're trying to accomplish. I think pre-treated skin, getting it ready to receive the next treatment, and I think has produced better outcomes.
And how do you explain to the patient that they should invest the time and the money in that pre-treatment?
Well, I think that's where a little bit of credibility or credentials comes in. I think that we have to remember in this industry that, and of course there's all stages of people entering into the med spa industry, which might be young professionals coming along or someone like us who've been around a minute, that there's a trust that it is sort of implied, but then you have to earn that trust. And so I have realized that as I get to this stage in my career, that they're counting on my recommendation. They're asking me for my recommendation. And so in the beginning years of my career, maybe I sounded a little wishy-washy, or I wasn't quite sure what my recommendations were. But now with confidence, I say to them, look, I would, even before Botox, neurotoxins, or dermal fillers, I ask them to go have a consultation with my esthetician, my skincare specialist, and let's start with a facial. Let's get your skin clean. Because you know what? When it comes to fillers, they're expensive. If I can cure your fine lines and wrinkles with something less expensive, and have you do that partially at home with home care regimen, then why am I going to spend expensive fillers to put in your face only where they need to be? So a lot of things we can accomplish with just basic 1, 2, 3 measures, which includes good skincare.
What are your favorite clinical products to recommend before a procedure?
Well, and actually I might throw some of this back to you because you're the biochemist expert physician for his clinical products. But one thing, and I've learned some of this from our daughter, Faith, who's a new up-and-coming skincare specialist, soon-to-be esthetician. We're very proud of her. But I think when you talk about the clinical mantra, which is cleanse, treat, hydrate, protect, well, let's start in the beginning. So I think a good cleanser, and I've become a big advocate of that myself, so the cleansing complex. And so if you have the opportunity with the client, maybe sometimes when you structure their treatment day, maybe that first treatment session is a good facial in the facial treatment room. I've sometimes done this on the same day, where if we're planning an IPL or say a fractional, non-ablative fractional treatment, or even a Botox or filler treatment, I'll ask them, I would love for you to get a facial in the room, get a proper cleanse, and then that way the skin is very clean and ready to receive the treatment. Hydration is very important, so maybe it's the HydroCool pre or post treatment, depending on what it is you do. We talked a little bit earlier about maybe a post-treatment shield, and I think we had some conversation about that when is it appropriate to do something in the office after you've done maybe an IPL or non-ablative fractional, which is causing some micro injury to the skin and post-treatment swelling. I sometimes have oscillated because some of the reps for some of these equipment said, don't do anything for 24 or 48 hours. But I think his clinical has some very mild, friendly products that can be safely used, maybe not immediately, but maybe within the first 24, 48 hours after a treatment like an IPL.
That's definitely true. Now, I would agree with the laser reps who say, don't put something occlusive immediately on the skin because that will increase the inflammatory response, and you don't want to do that. However, with his clinical products that are effective yet mild, depending on the time of day you did the laser, let's say you did it in the morning, you certainly could begin to use products that evening. And an ideal, very simple regimen that would optimize treatment outcomes would be cleansing complex plus shield. The reason for that is the shield is great post-procedure because it has bioidentical lipids that step in and take care of, sort of replace the lipids in the skin barrier until the skin itself can make those again. It also contains ingredients that are DNA protective. And we know that any energy-based device, it provides definite benefits, but it also provides some stress to the skin and some free radical damage because it's an energy-based treatment. So it's good to begin right away to, I hate to say counteract. We don't want to counteract the effects of the laser. Complement the effects of the laser with something like Shield. It's also antioxidant rich. You need that for free radical protection. Why do you need the cleansing complex at all? Well, you need it because with those little fractional wounds, they heal from the outside in, and there's some inflammation going on. Inflammation generates healing. And you want to have a product, a cleanser, that will clear that inflammatory and post-inflammatory debris. So you really, for optimal results, you really need cleansing complex plus Shield. And that's really simple for anyone. It also increases comfort, and patients like that a lot.
Yeah. And of course, we talk about protection after some of these treatments because now the skin's very sensitive. So bringing in the Extreme Protect, maybe the 30.
How do you speak to your patient in terms of education or explaining to them that this pre-treatment regimen is important, especially if they come in, maybe they haven't seen you for a long time and they might be a little bit resistant to spending the money for that?
Well, it's about education, and of course there's a little bit of a trust relationship that occurs, so they're asking for a recommendation. What's my best recommendation to get the best outcome? And I can just speak to my years of experience of doing this with many thousand patients, that this is something that I've grown to know the importance of how important it is. So, and we'll also give them a price break if we know they're going to be coming in spending a lot of money on, we want to get the most bang for our buck on this more expensive IPL or fractional laser. So sometimes it's a way for us, like almost like a lost leader, so to speak. Let them come in, let them get in, because many times they've not ever had a facial. So before we just jump to the big gun, let's put them in the facial room and let our skincare specialist give them a proper facial. We happen to have a hydrofacial. We love that. We've had that for 17 years. So they can really extract, clean the pores, get their skin nice and clean. And usually once they've had that experience and it didn't cost them a lot extra on that initial, they're in love and they want to be back in that facial room after the treatment we're going to do in terms of the more aggressive treatment.
And what would you say, now I know you see patients, you have patients you've seen for a long time. You have patients that are relatively new to the practice. But considering all that, and that there's a variation in the amount of pre-treatment that will be possible, what would you say is the optimum time for you that a person is on a pre-treatment regimen before they go through, say, an IPL or a fractional laser?
Well, I think it obviously starts with their skin condition to start with. So, you might have somebody come in that's got beautiful, perfect skin, and we just need to do a little neurotoxin. They got inside of the eyes, we need to treat that, or glabella or forehead. So maybe that particular condition is not as important about how much of the pre-treat we do. For someone who maybe has melasma or hyperpigmentation or some scarring, things that are maybe more important, how much of that pre-treatment phase we do. And not just that, it's kind of like, why don't we start with the basic things and see how much progress we can make. And I tell you right now, in our industry, relationship is so important, forming that relationship. I've heard this so many times, Dr. DeHaven. A patient comes in and they literally thank me at the end of our consultation because they said, I just went to 3 other med spas last week, and you know what they gave me? They gave me a treatment plan that was, I had to spend $8,000 a day, $10,000, whatever it was, and they just said, I just felt like they were trying to get into my wallet. And I said, well, I am here to do the best thing for you. Start with simple things, and then we can build that treatment plan over time. It might be we need to do some of these things later, but why don't we start with the basic things that are the most cost effective? And when you deal with a patient or a client that way, you earn their trust. And I'm a firm believer that there can be a certain initial trust because they're coming to see you, but that trust has to be earned over time. And I believe doing your best to protect someone's wallet, and I always say, they're making an investment. you always want to give them
They
more
are,
value
truly.
in return than whatever their investment was. And it might be that we need to spend bigger money for a fractional laser, especially if someone has bad cystic acne scarring that they occurred in their adolescent years. I have seen so many of our clients transform their social position, their self-confidence, because we were able to treat that acne scarring. But that might be a combination of the fractional along with your super serum or some combination to really help mitigate those tough scars.